Late night. Thanks for staying on. Reporting continues now on Newsroom Africa Channel 405. Now, Kenya has received its 1 million doses of the AstraZeneca Covid-19 vaccine, making it the first East African country to get a shipment of the vaccine. And the Ministry of Health in that country has said that it will set aside 400,000 doses for medical workers. And of course, for more of that, we're joined now by Terry Nzao, who is in Kenya. She's a journalist there, and she'll give us a little bit more detail. Terry, good evening, and thank you very much for joining us tonight on the Newsfeed Late Night. How elaborate is Kenya's rollout plan for the vaccines?
Thank you. Good evening to you from Nairobi, Kenya. We've already received the first batch of the COVID-19 vaccine, the AstraZeneca vaccine. And this is the first batch of the 1.0 million vaccines that we are the Kenyan government had already ordered. And so far it has been taken to the warehouse at the outskirts of Nairobi. That's the main depot at Kitengela. And all plans have been set for the rollout exercise, where we are expecting tomorrow to have the first Kenyan vaccinated against this COVID vaccine. And there are plans which have already been set by the Kenyan government, like what we've been already told by our Minister of Health, that is Mutahi Kagwe. There are plans to ensure the safety of the vaccine. They have the control rooms with set temperature rooms to ensure that the vaccine is still in order and does not expire or does not have any contamination. And in terms of distribution, we are expecting to have like 8 sub-counties, sub-regions, apart from the Nairobi main depot, where they will be distributed, and the main hospitals can get the vaccine from there.
All right, let's talk then about the strategy as far as regulatory preparedness is concerned. What are the technical issues there around the approval of the vaccine to be used? The manufacturing companies and the agents, have they submitted their applications to the regulatory bodies, and what is the news?
Sorry, come again?
As far as regulation is concerned, have the companies producing the vaccines submitted their applications to the regulatory health authorities there?
Yes, sure. Remember, the AstraZeneca vaccine dose, they arrived from the Serum Institute in India, and it's part of the 24 million doses that Kenya had ordered. And they had an agreement in terms of how secure the vaccine is, and any other measures that are supposed to be taken. For example, in most of hospitals, we've already trained, the Kenyan government says it has already trained like 400 healthcare workers who are going to handle this vaccine, or who are going to administer the vaccine to Kenyans. And all measures have been put. The ministry is working with other stakeholders in the health department, and they have already said the first batch of the COVID-19 vaccine is going to be administered to the frontline healthcare workers. Then from there, they might extend to the vulnerable groups like the security, the healthcare personnel, and other people who are at risk.
Yeah. And where is the planning and coordination of this entire strategy being handled?
Already we have a committee that has been handling all this, and there's plans which have been set by the Kenyan government regarding this. Like I said, we have one, Dr. Willis Akwale, who is chairing the coordination of the coronavirus task force. And they have already said they will be monitoring on how the people will receive this jab or this vaccine. Remember, after 8 weeks, they're supposed to receive the second jab. So there are there are measures which have already been planned. A budget has already been put in place on things to do with procurement, with how the vaccine is going to reach the counties, and issues to do with advocacy and training of these healthcare workers.
Yeah, let's talk about that, the budgeting and the funding of the vaccines. I believe Kenya is going to be doing some kind of a mixed rollout plan with Covax and as well as some funding from domestic sources. How is that going to work out?
The Kenyan government says that in the first phase is planning to use 933.2 million. This is in this first phase, where 592.6 million they expect to be used in storage, distribution, clearance, things to do with procurement, 70.8 million to be used in training, whereas 17.2 million shillings, Kenya shillings, is set aside for planning and coordination, whereas 232 million shillings, like I said, will go to advocacy, communication, and mobilization. There's another money which has been set aside for data management and monitoring. This goes around 20.6 million Kenya shillings. And all this is planned under the Ministry of Health, which says that in the first phase is going to fund fully the total budget of the COVID-19 vaccine from their own resources, whereas in the second phase, as we near the budgetary allocation, now we can see with the finance ministry trying to put aside money for this. But for now, the government says it will spend about 933.2 million in the first phase to cater for the COVID-19 vaccine.
Now, when we look at the targeted population in terms of the vaccine strategy of the three phases, it does seem that the 49 or so million doses will only cover about 30% of the population in Kenya. What is the government saying about this low target, and is it likely to revise the target?
Yes, already the task force that's handling the COVID-19 vaccine says in the first bunch and the second process, they are going to involve the healthcare workers, then on the second, the vulnerable groups that are people above 50 years and above, and others who are around 18 years and above, but they have underlying factors. Then from there, we go to the third stage. These are the other populations, and on the process they are saying they expect more of these doses of the vaccine even outside the AstraZeneca vaccine. So it will depend with how time goes by, and probably, who knows, by the time we are on the third phase, probably we would have cleared the COVID wave.
Now let's talk about the cold storage handling or the supply chain management. I know you touched on it earlier on. Of course, the AstraZeneca vaccine does not require a lot of negative temperature storage, but the Pfizer vaccine, I believe, does. What's the plan in place as far as the cold chain management is concerned?
Like I said, in Kenya, we have one main depot, and this is in Nairobi. A place called Kitengela, outskirts of Nairobi, Kitengela, and they have set other 8 regional depots. These are where other places like the sub-counties will be receiving the main vaccine, and our Minister for Health has already said they have plans for storage, and to be sure, it's they are saying they can store 6 months. They have the capacity to store 6 months vaccine stock at one time, and they have cold freezers and rooms. For example, for they can handle 130,000 liters and between 2 to 8 degrees Celsius, and if it is on the negative side, they have a capacity of around 14,400, which can handle below 20 degrees Celsius. And they are saying they have also placed other measures, things to do with what happens in case of a power outage or in case of a blackout. They are saying that they have generators ready for that, and also they have put other measures to ensure that this plays in hand. And each year, this main depot, the government says it has already, before it handles vaccine worth 6 billion. So for them, this is not something new, and they are prepared for this, and they are assuring Kenyans that this vaccine will be safe at the main warehouse or the main depot.
Now, Terry, talk to us about the involvement of private companies in procuring a vaccine. Can private companies at this point in Kenya import vaccines, but also what is the role that is played by the private health care facilities?
The Ministry of Health has been working in hand with the private sector, but so far the government has been in the forefront of procurement of the disease, but the vaccine. But they are saying in future they will involve even private companies to take place in procurement. Because when we look at now, at the moment, they are saying for the first phase, the COVID-19 vaccine will be free for the people who will be receiving this vaccine. But as we go into the second phase, each Kenyan will be receiving this vaccine will be needed to pay Kenya shillings 200, and probably with more people being involved in the procurement process, would see even the vaccine becoming more cheaper, and having more vaccines into the country, and even increasing the numbers of people who are going to receive this jab.
Terry Nzao, journalist based in Kenya, I appreciate your time. Thanks for joining us tonight on the Newsfeed Late Night. All right, we'll recap for you what's making news in the next hour here on the Newsfeed Late Night. Stay with us.